Since it was founded 70 years ago, the NHS has been there for us all. Yet today, our health and social care system is facing more pressure than ever, with increasing financial, operational and demographic challenges, and 70% of the budget now being spent on supporting people with long-term conditions. The system can also sometimes fail to deliver on the things that people really value, such as being listened to, having a say in what happens to them, experiencing a joined-up service, and being treated with dignity and compassion. Therefore, the need for the system to move towards a personalised care approach is now more urgent than ever. So what is personalised care? Personalised care is where people have more choice and control over how their health and care needs are met. It recognises that people themselves can sometimes be the best integrators of health and care, and supports them to live as independently as they wish. With personalised care, people are more involved in the decision-making process and should be supported to talk about the outcomes that matter most to them and what is the best course of action to achieve these outcomes. The result is better health and well-being outcomes for them, plus more effective and joined-up services. People aren't left on their own, but are supported to develop their knowledge, skills and confidence, and can take on as much responsibility as they want to manage their health and well-being. The NHS will, however, always be there to support people, as it always has done. As we move towards offering a more personalised system, it's important to have a clear approach, and that's why we've established our comprehensive personalised care model. This is an all-age, whole-population approach to personalised care. It focuses on helping people to achieve better health and well-being outcomes by accessing specific personalised care interventions. To start, the whole population can be supported to stay as well as possible through community resilience and enabling people to make informed choices when their health changes. There are a number of universal interventions which help to achieve this, including shared decision-making and patient choice, which means treating people as equal partners in decisions about their care and treatment, and social prescribing and community capacity building, which means building relationships with voluntary organisations and referring people to non-clinical local support services where appropriate. The next group are people with long-term physical and mental health conditions, who make up around 30% of the population. A personalised care approach supports these people to build knowledge, skills and confidence to better manage their health and well-being through a series of targeted interventions, in addition to the universal interventions. These include personalised care and support planning, which is a proactive process bringing together people's physical, mental health and well-being needs into a single process and joined-up plan, which is focused on what matters to them. Support to self-manage. The patient activation measure can be used to target these interventions, including health coaching, self-management education, and access to peer support. The third group are people with complex needs, who typically have multiple long-term conditions and a functional impairment, and who make up around 5% of the population. A personalised care approach provides intensive specialist interventions to empower these people and integrate their care and support so as to reduce unplanned service use. These interventions include the targeted and universal interventions, as well as personal health budgets, integrated personal budgets, and integrated personal commissioning, which enables people to take direct control of the resources available for their health and care. Finally, the model recognises that the system needs to be flexible and adapt to the fact that individuals often have changing health and care needs. Involving people in their own health and care not only adds value to people's lives and experiences, it creates value for the taxpayer and better integrates the system around the person. The comprehensive personalised care model demonstrates how this more personalised approach can become a reality. To find out more, visit england.nhs.uk.